Are your legs feeling weaker every day? Do you struggle to get up from a chair without using your hands? Maybe you've noticed you're shuffling when you walk instead of taking confident steps like you used to. Here's what most seniors don't realize. Weak glutes are stealing your independence right now, and every day you wait makes it harder to get that strength back. Your glutes aren't just about appearance. They're the foundation of everything you do, from walking to the mailbox to playing with your grandchildren. And when they weaken, your entire body pays the price. But here's the good news. You can rebuild that strength starting today with 5 simple exercises that take less than 15 minutes. And I'm going to show you exactly how to do them safely and effectively because you deserve to move with confidence and freedom no matter your age. My name is Dr. Rebecca Parker. I've worked as a physician for over 20 years, and today I focus specifically on senior health. I've seen thousands of patients over 60 struggle with mobility issues, and I can tell you with absolute certainty that weak glutes are at the center of most falls, hip problems, and loss of independence in older adults. But I've also witnessed incredible transformations when seniors commit to strengthening these critical muscles, and that's exactly what we're going to talk about today. You're not alone in this struggle. Across America, millions of seniors are dealing with weakening glutes without even realizing it. You might think it's just normal aging, that it's supposed to get harder to stand up or walk upstairs, but I'm here to tell you that's absolutely not true. Yes, our muscles naturally lose some mass as we age, but the dramatic weakness so many seniors experience isn't inevitable. It's preventable and it's reversible. The gluteal muscles, which include your gluteus maximus, gluteus medius, and gluteus minimus, are the largest and most powerful muscle group in your entire body, and they control almost every movement you make from the waist down. When these muscles weaken, you're not just losing strength in your backside, you're losing your ability to walk properly, to balance yourself, to stand up independently, and to live the active life you deserve. Let me explain what's really happening inside your body. Your glutes are responsible for hip extension, which means they're what push your leg backward when you walk. They control hip abduction, which keeps you stable side to side, and they manage external rotation, which helps you turn and pivot safely. Think about getting out of a car, climbing stairs, standing up from the toilet, or even just walking across your living room. Every single one of these movements depends entirely on strong gluteal muscles. When your glutes weaken, other muscles try to compensate, particularly your lower back and your knees. And this is exactly why so many seniors develop chronic back pain and knee problems that seem to come out of nowhere. Your body is crying out for help because the foundation has crumbled. If this resonates with you, hit that like button because this information could change your life, and it helps other seniors find this material that they desperately need. Here's what concerns me most as a physician. Weak glutes are a direct path to falling, and falls are the #1 cause of injury and loss of independence in seniors across America. According to research, 1 in 4 Americans over 65 falls every year, and many of those falls happen because the glutes couldn't stabilize the hips during a simple movement like stepping off a curb or turning around quickly. When you fall, you're not just risking a bruise, you're risking hip fractures, head injuries, and a devastating loss of confidence that keeps you from moving altogether. I've seen patients who are active and independent become homebound after a single fall, not because of the physical injury alone, but because they became terrified of falling again. This fear creates a vicious cycle where you move less, your muscles weaken further, and your risk of falling increases dramatically. But it doesn't have to be this way. Your glutes can be strengthened at any age, and the exercises I'm about to share with you are specifically designed for seniors, which means they're safe, effective, and you can do them right in your own home without any expensive equipment or gym memberships. These aren't complicated movements that require you to get down on the floor and struggle to get back up, and they're not high-impact exercises that put stress on your joints. These are gentle yet powerful movements that target your gluteal muscles precisely where you need it most, and when done consistently, they can restore strength, improve balance, and give you back the confidence to move freely through your daily life. Let me start with the first exercise, and this one is so simple yet so effective that you'll be amazed at how quickly you feel results. It's called the standing glute squeeze, and here's exactly how to do it. Stand next to a sturdy chair or counter and place one hand lightly on it for balance. You're not leaning on it heavily, just using it for stability. Stand with your feet hip-width apart and your knees slightly soft, not locked. Now here's the key. Squeeze your glutes together as tightly as you possibly can. Imagine you're trying to hold a dollar bill between your buttocks and someone's trying to pull it out. Hold that squeeze for 5 full seconds while breathing normally. Then release and rest for 3 seconds. That's 1 repetition. Start with 10 repetitions, rest for 30 seconds, then do another set of 10. What makes this exercise so powerful is that it teaches your brain to reconnect with your gluteal muscles, something called neuromuscular activation. Many seniors have what we call gluteal amnesia, where the brain has essentially forgotten how to fire these muscles properly because they haven't been used effectively in years. This exercise wakes them up and reminds your nervous system how to engage these critical muscles. You can do this exercise anywhere, while you're waiting for your coffee to brew, during commercial breaks while watching television, or even while standing in line at the grocery store. The beauty is that nobody around you can even tell you're exercising, but your glutes are getting stronger with every squeeze. The second exercise builds on that foundation, and it's called the standing hip extension, and this movement is absolutely essential for walking strength. Start in the same position next to your chair or counter with one hand resting lightly for balance. Stand tall with your shoulders back and your core gently engaged. Now slowly lift one leg straight back behind you, keeping your knee straight but not locked, and squeeze your glute at the top of the movement. Your foot should only come up about 6 to 12 inches off the ground. This isn't about how high you can kick. It's about controlled movement and muscle engagement. Hold for 2 seconds at the top, really squeezing that glute muscle, then slowly lower your leg back down with control. Do 10 repetitions on one leg, then switch to the other leg and do 10 more. Here's what's happening inside your body during this exercise. You're strengthening the exact movement pattern your body uses when you walk, and you're training your glutes to fire properly during hip extension, which is absolutely critical for a strong, confident stride. I had a patient, a 72-year-old woman from Ohio, who came to me because she'd started shuffling when she walked and her daughter was worried she was going to fall. We started with just these first 2 exercises, the glute squeeze and the hip extension, and within 3 weeks, she told me with tears in her eyes that she could walk to her mailbox without fear for the first time in over a year. Her legs felt stable, her steps were longer and more confident, and she'd even started taking evening walks around her neighborhood again with her husband. That's the power of consistent glute strengthening. It gives you your life back. Now let's talk about the third exercise, and this one targets a different part of your glutes that's absolutely essential for balance and stability, and it's called the standing hip abduction or side leg raise. Stand next to your chair or counter again with one hand for support. Stand tall and shift your weight slightly onto your left leg. Now slowly lift your right leg out to the side, keeping your toe pointing forward and your legs straight. Only lift about 6 to 12 inches. You should feel this working on the outside of your hip and the side of your buttock. Hold for 2 seconds at the top, then slowly lower back down with control. Do 10 repetitions on the right leg, then switch your position so you can do 10 repetitions on the left leg. This exercise strengthens your gluteus medius, which is the muscle on the side of your hip that keeps you from wobbling side to side when you walk. When this muscle is weak, you get what's called a Trendelenburg gait, where your hips drop and sway with each step, and this dramatically increases your fall risk, especially on uneven surfaces like grass or gravel. Think about walking through a parking lot or navigating your yard. Every time you take a step, your gluteus medius on your standing leg has to fire to keep your pelvis level and stable. When it's weak, you compensate by leaning your whole body side to side, which throws off your balance and puts enormous stress on your lower back and knees. Strengthening this muscle is like adding a stabilizer to your body. Suddenly you feel solid and grounded instead of wobbly and uncertain. Write in the comments, have you noticed yourself walking differently as you've gotten older? Maybe a shuffle or a sway. Share your experience, because your story might help another senior realize they're not alone in this. Now here's where we're going to add a simple protocol that you can follow every single day to maximize your results, and I call this the daily glute activation routine. Here's exactly what you're going to do. Every morning before you even have breakfast, stand next to your kitchen counter and do one set of each of these 3 exercises we've covered so far: 10 glut squeezes, 10 hip extensions on each leg, and 10 side leg raises on each leg. That's it. The entire routine takes less than 5 minutes. Then in the evening, maybe after dinner or while you're watching your favorite show, do the exact same routine again. By doing this twice a day, you're training your glutes consistently and giving them the stimulus they need to grow stronger without overworking them. Consistency is everything here. You're not going to see dramatic changes overnight, but if you commit to this simple 5-minute routine twice a day for 2 weeks, I promise you'll notice a difference in how your legs feel, how easily you can stand up from sitting, and how much more stable you feel when you walk. After a month, people around you will start noticing that you're moving differently, with more confidence and energy. And after 2 months, you'll look back and be amazed at how much strength you've regained in such a short time. But we're not done yet, because I want to give you 2 more exercises that take your glute strength to the next level, and these are slightly more challenging but incredibly effective. The 4th exercise is called the sit to stand with glute focus, and this one is brilliant because it strengthens your glutes while practicing a movement you do dozens of times every day. Find a sturdy chair that doesn't have wheels, something that won't slide when you use it. Sit toward the front edge of the chair with your feet flat on the floor, hip-width apart. Cross your arms over your chest so you're not tempted to use your hands to push yourself up. Now here's the key: lean forward slightly from your hips, keeping your back straight, and as you stand up, really focus on pushing through your heels and squeezing your glutes as you rise. Stand all the way up until you're fully upright and your hips are fully extended. Squeeze your glutes hard at the top, then slowly lower yourself back down to sitting with control. Do 8 to 10 repetitions, rest for 1 minute, then do another set. This exercise is phenomenal because it combines functional movement with targeted glute strengthening. Every time you get up from a chair, get out of bed, or stand up from the toilet, you're using this exact movement pattern, and by strengthening it deliberately, you're making every aspect of your daily life easier and safer. I remember a 77-year-old man from Minnesota who told me he'd been using his arms to push himself up from chairs for so long that he didn't even realize he was doing it anymore. His wife had pointed it out, and he felt embarrassed, like he was becoming feeble. We worked on this sit-to-stand exercise, and within 6 weeks, he could stand up from a chair without using his hands at all, and he told me it made him feel 20 years younger. That sense of independence and capability is priceless, and it's absolutely achievable for you too. The 5th and final exercise is called the glute bridge modified for seniors, and while this one does require you to lie down, I'm going to show you how to do it safely and comfortably. You'll need a yoga mat or a thick towel on the floor, and you'll want to do this exercise near a sturdy piece of furniture that you can use to help yourself get down and back up if needed. Lie on your back with your knees bent and your feet flat on the floor about hip-width apart. Your arms should be resting at your sides. From this position, press through your heels and lift your hips up toward the ceiling, squeezing your glutes as hard as you can at the top. Your body should form a straight line from your knees to your shoulders. Hold this position for 3 to 5 seconds, really focusing on that glute squeeze, then slowly lower your hips back down to the floor. Start with 8 repetitions, rest for 1 minute, then do another set of 8. This exercise is the king of glute strengthening because it isolates these muscles in a way that almost no other movement can, and it works all 3 gluteal muscles simultaneously while also engaging your hamstrings and core. The glute bridge has been shown in research to activate the gluteus maximus more effectively than almost any other exercise, and when done consistently, it can dramatically improve hip extension strength, which translates directly to better walking, climbing stairs, and overall mobility. Now I know some seniors are worried about getting down on the floor and back up, and that's a completely valid concern. If you're not comfortable with floor exercises, you can substitute an extra set of the sit-to-stand exercise instead, or you can work with a family member who can help you get down and up safely until you build enough strength to do it independently. If this video has been helpful so far, hit that like button because we're about to talk about how these 5 exercises work together to completely transform your mobility and independence. Here's what makes this program so powerful. These 5 exercises target your glutes from every angle and in every function they perform. The glute squeeze teaches activation and awareness. The hip extension strengthens the backward pushing motion essential for walking. The side leg raise builds lateral stability to prevent wobbling and falling. The sit-to-stand trains functional strength for daily activities, and the glute bridge maximizes overall gluteal power and hip extension. When you do all 5 exercises consistently, you're creating a comprehensive strengthening program that addresses every aspect of gluteal function, and the results compound over time in ways that will absolutely amaze you. Let me tell you about the progression you can expect. In the first week, you might feel sore in your glutes and hips, and that's actually a good sign because it means these muscles are waking up and working in ways they haven't in years. Don't let soreness discourage you. It's temporary, and it means the exercises are working. By week 2, you'll start noticing that the exercises feel easier, and you can perform them with better control and form. By week 3, you'll notice functional improvements in your daily life. Things like standing up from chairs more easily, walking with a longer stride, or feeling more stable when you're moving around your house. By week 4, other people will start commenting that you seem to be moving better, and you'll have significantly more confidence in your physical abilities. And if you keep going for 2 to 3 months, you'll experience a complete transformation in your lower body strength, balance, and overall quality of life. But here's what I need you to understand. These exercises only work if you actually do them consistently. I can give you the best program in the world, but if you only do it once and then forget about it, nothing will change. Your glutes need regular stimulus to grow stronger, and that means showing up for yourself every single day, even when you don't feel like it, even when it seems like progress is slow, even when that voice in your head says you're too old or it's too late. I'm telling you right now that you are not too old, and it is absolutely not too late. Your body has an incredible capacity to adapt and strengthen at any age, and I've seen 70-year-olds, 80-year-olds, and even 90-year-olds make remarkable improvements in their strength and mobility when they commit to consistent exercise. If you want access to exclusive content, detailed exercise videos, and personalized advice for your specific situation, become a channel member. There I share even deeper information, including modifications for different ability levels, advanced progressions as you get stronger, and complete weekly workout plans designed specifically for seniors. Now let me address some common concerns and questions I hear from seniors about glute exercises. First, many people ask how often they should do these exercises. For beginners, I recommend starting with a 3-exercise routine twice a day like I described earlier. Then after 2 weeks, you can add in the sit-to-stand exercise once a day. And after a month, you can incorporate the glute bridge if you're comfortable with it. You don't need to do all 5 exercises twice a day right from the start. That would be too much for most people and could lead to overtraining or burnout. Build gradually and listen to your body. Second, people often ask if they need to feel muscle soreness for the exercises to be working. The answer is no. Soreness is not required for muscle growth and strengthening. In fact, as you become more consistent with these exercises, you'll probably stop feeling sore altogether, and that's perfectly fine. What matters is that you're doing the movements with good form, focusing on engaging your glutes during each repetition, and progressively challenging yourself over time by adding more repetitions or sets as you get stronger. Third, I get asked about what to do if you have hip or knee pain. This is important. If you have significant pain during any of these exercises, you should stop and consult with your doctor or a physical therapist before continuing. However, mild discomfort or muscle fatigue is normal and different from pain. Pain is sharp, sudden, or severe, while muscle fatigue is a burning or tired feeling in the muscle itself. Learn to distinguish between the two and never push through actual pain. Fourth, many seniors wonder how long it takes to see results. As I mentioned earlier, most people start noticing functional improvements within 2 to 3 weeks, but significant strength gains typically take 6 to 8 weeks of consistent training. Remember that you're rebuilding muscle that may have been weak for years or even decades, so be patient with yourself and trust the process. Every single repetition you do is making a difference even when you can't see it or feel it immediately. Now here's something critical that most seniors don't realize. Strong glutes don't just help you walk better, they protect you from some of the most devastating health problems that affect older adults. When your glutes are strong, you're dramatically reducing your risk of falls, which means you're protecting yourself from hip fractures that can lead to disability or even death in seniors. You're also protecting your lower back from chronic pain and degeneration because your glutes are supporting your spine properly instead of forcing your back muscles to compensate. You're reducing your risk of knee arthritis and knee replacement because your glutes are stabilizing your hips and preventing excessive stress on your knee joints. And you're maintaining your independence and quality of life because you can continue doing the activities you love, whether that's gardening, playing with grandchildren, traveling, or simply living in your own home without needing assistance. Strong glutes are also connected to better metabolic health. Muscle tissue burns calories even at rest, so when you build stronger glutes, which are the largest muscle group in your body, you're increasing your metabolic rate, which helps with weight management and reduces your risk of diabetes and heart disease. Plus, exercise itself improves circulation, strengthens your heart, enhances cognitive function, and boosts mood by releasing endorphins. So when you commit to these 5 glute exercises, you're not just strengthening your backside, you're investing in your overall health and longevity in profound ways. If this material has opened your eyes to the importance of glute strength, hit that like button one more time because this information is truly life-changing for seniors. Let me share one more story with you because I think it perfectly illustrates the transformative power of what we've been discussing. I had a patient, a 74-year-old retired teacher from Pennsylvania, who came to see me because she was terrified she was going to end up in a nursing home. She'd fallen twice in 6 months, once in her bathroom and once in her driveway, and her children were pressuring her to move into assisted living because they were worried about her safety. She was heartbroken because she loved her home, her garden, and her independence. But she also understood their concern because she felt unsteady and weak. We started with just the first 2 exercises, the glute squeeze and the hip extension, because that's all she felt confident doing at first. She did them twice a day without fail, and slowly over the weeks we added the other exercises as she got stronger. After 3 months, she came into my office walking differently, standing taller, moving with confidence. She told me she'd walked a mile on the trail near her house the previous weekend, something she hadn't done in over 2 years. Her children had stopped talking about assisted living because they could see she was thriving. And she said to me with the biggest smile, "Dr. Parker, you gave me my life back." That's what strong glutes can do for you. They can literally give you your life back. So here's what I want you to do starting today. First, commit to yourself that you're going to try these exercises consistently for at least 2 weeks. Write it down, tell a family member or friend about your commitment, put reminders on your phone, do whatever you need to do to make it happen. Second, start simple with just the first 3 exercises, the glute squeeze, hip extension, and side leg raise, doing them once or twice a day. Don't overwhelm yourself by trying to do everything at once. Build gradually and celebrate small victories. Third, pay attention to how your body responds and adjust as needed. If an exercise causes pain, modify it or skip it for now. If an exercise feels too easy, add more repetitions or slow down the movement to increase the challenge. And finally, be patient and compassionate with yourself. You're doing something incredibly important for your health and independence, and that deserves to be honored and celebrated even when progress feels slow. Your glutes are the foundation of your mobility, your independence, and your quality of life. Every day you invest in strengthening them is a day you're protecting your future and ensuring you can continue living life on your own terms. You don't have to accept weakness and instability as inevitable parts of aging because they're not. You have the power to change your trajectory starting right now with these 5 simple exercises that take less than 15 minutes a day. Share this video with someone you care about, a spouse, a sibling, a friend who's also over 60 and might be struggling with these same issues. This information could change their life just like it's going to change yours. Subscribe to the channel and turn on notifications so you don't miss future videos where I'll share more exercises, health strategies, and practical advice designed specifically for seniors who want to stay strong, independent, and active for years to come.